I have with me here today Dr. Gary Donovitz, who is the president and founder of Bioidentical. How are you doing today, Doctor?
I'm doing great, John.
Great. I have a couple questions for you because I have been using the Bioidentical hormone replacement therapy myself, and so I want to talk to you about how great I'm feeling, plus get some information from you.
That'd be great. I'd be glad to tell you whatever you want to know.
All right. I have the book, Age Healthier, Live Happier. Congratulations on your best-selling book anyway, so why don't you tell us a little bit about it?
Well, so I started the book about a year ago because I found that men and women were hormone deficient, but they were never getting their hormones checked. It seemed as though every time they went to the doctor, it was all about what problem was going on that day, and they kept getting over-medicated. So at some time in their life, they were on 5 or 10 or more medications, just putting a Band-Aid on the problem, not really looking at what was causing the problem. In addition, our seniors were getting over-medicated, and again, no one was looking at their hormone levels for both short and long-term benefits. So I wrote the book so that people could say, you know what, I think most of my problems, the fact I can't remember things, the fact that I'm tired, the fact that I don't sleep well, the fact that I'm gaining weight, all things were really hormonally related, and they really didn't need antidepressants. They really didn't need diet pills and fad diets. What they needed was hormone optimization so they could really feel their best no matter what their age.
And I can say for myself, getting the hormone replacement therapy has made me feel 10 years younger for sure. Now, can you kind of explain to us what is hormone replacement therapy?
Right. So as we get older, our hormones start decreasing. In women, the testosterone will start decreasing in the mid-20s. In men, the testosterone will start decreasing in the 30s, and then it just keeps decreasing. In fact, by age 40, most women have lost half of their testosterone. Later, as they go through menopause, they'll also lose estrogen. Both men and women begin decreasing their thyroid hormone production early, sometimes as teenagers. So the combination of all those hormones is really what makes us feel our best. And it's also those hormones that keep us from developing long-term diseases like heart disease and diabetes, Alzheimer's disease, breast cancer, prostate cancer, and osteoporosis. So hormone replacement therapy, or what we do is really hormone optimization, is to say what hormones are you missing and how can we replace those in an optimal fashion, in an easy fashion, hassle-free and safe, so that you feel as good as you did when you were in your 20s.
That's amazing. The benefits of the hormone replacement therapy just continue to go on and how great it is. So now, can you help me understand what are bioidentical hormones?
Well, bioidentical hormones are hormones that are made to look exactly like the hormones that your ovary or your testicle made throughout your life. Many people, in fact, for more than 60 years, have been using synthetic hormones, even though bioidentical hormones, the ones that you've been making that look just like your testosterone or just like your estrogen, have been available. And the synthetic hormones come with a whole host of side effects. The benefits aren't as good, and the side effects are more. So we can expect that the long-term benefits are going to be not good. That's why you see in so many studies people have increased risk for blood clots, heart attacks, stroke, and breast cancer on synthetic hormones. You don't have any of those complications with bioidentical hormones delivered by BioT pellet therapy. That's why we use the pellets. So it's something you don't have to take orally, and I can give you more information about that if you want.
We'll stick with the pellets because that's what I'm experiencing. Does that make sense?
Sure, because most people have been taking oral hormone replacement therapy for years. So if you take any of the hormones orally, and for testosterone, there is no bioidentical testosterone that's absorbed orally, so you have to use a synthetic hormone. Those synthetic hormones taken orally, again, increase your risk for blood clot, heart attack, stroke, and oftentimes people find that out and say, well, I'm just not going to take the risk and quit taking their hormones. That leads to long-term problems because now you don't have protection for Alzheimer's disease, heart disease, diabetes, breast cancer, and so forth. The pellets are bioidentical hormones that are compressed into little small pellets that are the size of a little chiclet, put back in the fat by the hip. Those things can be put in 2 or 3 times a year, They're pretty much hassle-free being put in, and you maintain constant hormone levels just like you did when your ovary or testicle was working appropriately.
Wow, that's amazing. So what kind of, what kind of symptoms are people going to experience that might lead them to think they may have an imbalance in their hormones? And when should they start to consider that therapy?
So women in the mid-20s often will say, you know what, I can't remember things like I used to. They have mood swings, irritability, anxiety, depression. A lot of them even get put on antidepressants. They can't lose weight, even though they exercise and even though they diet. They're not sleeping well. They're tired all the time, particularly in the afternoon. Often they'll have hot flashes or night sweats and joint pains. And so the combination of those really can lead people to a horrible life, poor quality of life. In men, it's the same. Sort of in the mid-30s, the guys start thinking they're tired, they're more irritable. They can't maintain muscle mass. They're not sleeping well. And again, those people are fatigued in the afternoon. Sexual performance is down. So in women, you'll see a decrease in sex drive. In men, you'll see a decrease in sexual performance. The combination of those things can lead to just a decrease in quality in anybody's relationship and a decrease in quality of life at work also.
Well, that's for sure. And so people can benefit. The medical benefits from the hormone replacements are far greater than you realize because it affects you not just on a physical level, but it can also affect your personal life as well.
Right. We find that people who are optimized on their hormone, their personal lives are better. If their personal lives are better, they're much more productive at work, and they don't keep having all of those diseases that come along. They don't get sick as often. Their immune system is better. They don't keep gaining weight, which then can lead to diabetes, and from diabetes to other problems. So the healthier that you are hormonally, the healthier your body will be on the long term.
Wow. And I can attest to the benefits of receiving the BioT hormone therapy replacement because I feel younger. My relationship with my wife is better. We seem to connect on a different level that we had lost all those years ago because I was sluggish, and I know that I myself had been feeling just run down and less than I had been years earlier. So why do you think that choosing a BioT provider for hormone therapy over someone else is a benefit?
Well, a lot of people have used pellet therapy. Again, it's been around for 80 years. It's used in 5 continents around the world. What BioT did, and the reason that I started the company, was to train physicians how to use pellets, moreover, how to optimize hormones. So it's not just here's a pellet and putting the pellet under the skin. It's about optimizing their hormones, looking at their thyroid. The BioT physicians are also trained in nutraceuticals, which are vitamins to make your cells healthier so that they can receive those hormones in a better fashion. A lot of people buy pellets over the internet, never learn how to insert them, never learn how to do hormone optimization, lose all the benefits of the pellet, and take the risk of doing it the wrong way. So the people that are BioT certified have gone through a certification course, have been instructed on how to insert the pellets by trainers who watch them do it. They have a dosing site that's based on 30 years of experience and the highest quality pellets tested by independent laboratories, not just the pharmacies that make them.
Wow. I love my BioT provider. And it was so informative when I went and received my pellets for the first time that she set me at ease. She made me feel like I was educated when I left and I knew exactly what I could expect. And so for me, I can't say enough about the BioT providers. So thank you so much.
Well, I'm glad to have that great feedback. And we're going to continue to change healthcare, not just to pellets, but to change healthcare. And if we can change healthcare across the country, we can actually do something to make medicine a lot more fun for the doctor. And we can do something on the go forward so that the patients actually feel better no matter what their age. That's the real goal. The real goal is to make things so that we're doing health care versus disease management. For
Right.
so long, we've just been giving patients pills and creams and one Band-Aid after for problems. At the end of the day, the patients don't feel better, and actually their quality of life is quite terrible on the go forward.
Yeah, and what I have noticed with the pellets is not something that's just masking the symptoms. It's actually helping me live a better quality of life.
Right, and that's the whole thing. Feel healthier, get your hormones optimized, and your quality of life is better, not just yours, but on the go forward, no matter what your age. I have people as old as 90 years old on pellet therapy who are living great lives. Prior to that time, they were sluggish, thinking that it was almost the end, and now they're revitalized.
Well, I'm
So
45 years old, and I don't ever want to spend another day without my pellets. I can tell you that much, just from my experience in this short time. And my wife is exactly the same. She received the pellets, and she tells me she feels like a 20-year-old girl again.
So it looks like couples therapy worked again.
Amen to that, sir. And we didn't even need it. And it's just been so wonderful for our relationship. I just can't say enough positive things about it. I may have classified myself once before as a Bible thumper, but I'm a pellet thumper now.
Awesome. I'd like to hear that.
All right, Dr. Donovitz, thank you so much for your time and for your informative information on all this. Tell us again the name of your book and where we can get it.
So the name of the book is Age Healthier, Live Happier, Avoiding Over-Medication Through Natural Hormone Balance, and everyone can get that on Amazon.com. And thanks, Sean, for having me on.
No problem. Thank you for being a part of the show. We really appreciate it.
Call me anytime.